Welcome to Healing Step to Wellness with Dr. J and Mei, your trusted guide to whole person health, one step
And one bite
at a
at a
time.
time. Yes. So, well, thank you very much for joining us on the Healing Step to Wellness. And this is a space for us to invite all the speakers, share the wisdom with us. And it's a space we talk about the lifestyle medicine and something fun about that, not only healthy, but also fun. Okay. So, who is our guest today?
Hi,
The
I'm
the
Dawn
most
Ritter,
famous nurse practitioner.
nurse
Uh,
practitioner.
Yeah, Don
Thank you.
Ritter. Yeah, Don actually was our guest a couple weeks ago, and we had so much fun, so many subjects to be continued while now getting to the winter. So, Don, still, please share a little bit about yourself, and so we can kind of bring the new audience up to speed, and we will start with our chat today.
Well, thank you for inviting me to be here. I really appreciate any opportunity to talk about how we can heal. And when we learn more about ourselves and our body, we then know which steps to take so that we can feel as well as possible. So yes, we're entering into winter. I've had the privilege to be working at the Rochester Clinic now about a year. And it's been an exciting growth for me because most of what I see is women's health issues because I think we're just really very complex. We go through a lot of changes in our lives. And women ask also. It's not that men don't have issues, but I think we're often good about asking for information about what's going on because
Mm-hmm.
there's a lot going on.
Mm-hmm. Mm-hmm.
Mm.
Yeah. So that kind of give our audience a hint. That's the topic we are going to focus on today. But before we dive into that, I just want to share with our audience that Dawn has more than 2 decades, to more than 25 years of
Oh
the
yeah.
clinical experience.
Mhm.
You previously worked at a Mayo Clinic, but you've kind of found your passion. You start to focus more on the functional and lifestyle medicine. So can you kind of give us a little bit overview about the functional lifestyle medicine, but actually what is your approach? How does set yourself apart from the other practitioner, especially at Rochester Clinic here?
Very different from the initial training that I received as a nurse practitioner. I had an excellent education through Winona State University, years of practicing with Mayo and as a nurse, very integrative, but it didn't quite fit the needs that I've learned in the last, especially 10, 15 years of my practice, that it's very difficult to have people come in to be seen and they say, I'm having stomach aches, and just talk about their stomach. It's
Mm,
impossible. And that's the way I was trained. It was like, oh, well, we better hone in on the stomach. Or I'm having headaches. Oh, well, what could be causing these headaches? So what has happened because of my practice is that I've learned again that we are integrative. We are not just a brain. We're not a heart. We're not just our
mm,
vasculature. I remember the early years of endocrine studies in how it was so complicated. It's like, okay, we'll just set this over here. That's for menstrual cycles and babies and all that. That's not true.
mhm,
So my approach to integrative medicine is literally looking at the whole person and the effect of the way their body is receiving nutrition, the way our body is releasing toxins, how are we supporting our hormone health? And the best way for us to do that is to routinely take an opportunity to say, okay, what am I currently practicing in my everyday life? Am I getting enough sleep? What am I putting into my body routinely? Of course, there's things that maybe aren't best choices, but that's not the greatest concern. It's the everyday routine. What medications am I putting in my body? What are my symptoms? Am I feeling fatigued? Am I not sleeping? Am I feeling cold all the time? Am I having a routine menstrual cycle? For women, especially. For men, it's often energy, it's interest in getting outdoors and enjoying life, it's mood issues. And that's not just one little piece of us, it's the whole picture. So my approach, there's how many pages to our intake? At least 4 pages that pertain very specifically to people's symptoms, how they're feeling, and how they manage their day-to-day life. And then we go from there and try to identify what could be the underlying cause of their concern. We also get people coming into the clinic that want to elevate. I have people that are very well. They don't have maybe some terrible things going on, but they want to stay well. They might be in their 30s, 40s, 50s. We have people in their 70s and 80s that say, I really want to live my best life. How do I keep doing that? So it's gathering information and then making a plan to continue nurturing our lifestyle and our bodies.
Okay, so coming from the simple man's mindset, I'm going to ask one simple question for the complex women's issue. What are the most common signs of hormonal imbalance in women that you are seeing in your practice?
Well, from their perspective, even, family members can say some things too, but I will often have women say they're not sleeping, they're feeling anxious, their mood is very labile. I often, well, it's like, and I've experienced this, of course, myself. Why am I so snippy? Or why is my husband saying, whoa, what's going on today? So mood issues, maybe sleeplessness, thermal regulation, feeling cold, hot flashes, sweating. And I think weight gain is always a concern because we know that's related, but many women will say, why am I gaining weight? I'm not eating really any differently. And that might be the problem, that they've gotten into a food pattern that's really not good for them. So we want to feel good. We want to look good. We want our mood to be pleasant. We want our family to be around us. And I think a lot of things too, women will say that work gets to be more stressful. They're having trouble concentrating. They used to, be able to manage a team and projects, and they're just struggling. So I think women are very intuitive to those kind of changes, and they do express it that way.
So as you mentioned that all the systems are connected together, especially when you talk about weight gain. Now, besides the female hormone, it actually is highly related to thyroid. And so how do you use the advanced lab testing to test for all those systems together?
So I've learned that the old 1-TSH or thyroid stimulating hormone lab is not enough. And it's utilized routinely in general medicine, and women are told routinely, your thyroid's fine, don't worry about your thyroid, get some rest, take this pill for your anxiety, whatever. What I want to do is do that whole thyroid panel that can include up to like 6 different tests, but for sure we want to see that the T3, free T3 is transitioning to T4 is transitioning to T3. I want to know what that TSH level is. I want to know if there's antibodies that would reflect an autoimmune response going on in the body that leads to Hashimoto's thyroiditis. I also have had some very similar issues where women are feeling anxious, or if a woman has ever told me that they've had panic attacks. I was in the emergency room. They said, I'm just having a panic attack. I'm going to do a full thyroid panel. I've found several women who are actually in hyperthyroid, and that's very serious. They're in very high metabolism, and it affects situations like that of having, really a panic attack. And it's not my goodness, I'm not afraid of anything. I'm not a nervous person. Why is this happening? Because the metabolism is just racing. So yeah, that full thyroid panel, there's a reverse T3 also. But at least 4 of those tests I would have before I would tell a woman or a man that their thyroid is fine. Yeah.
Well, on that subject, so I have experienced many people, they share with me that when they were being tested at some place, and like a list of a long list of the test, and like you have the like a risk marker is red, black, or whatever the color. So it's not as simple as just like, oh, the red, so everything is bad, or how you read those lab. I think that's kind of puzzle me.
I love that question. Really, May, I do, because what we also find in these visits with folks that need more information, wanting to understand, because they're seeing their lab results too, and it's like, gosh, doesn't the range matter? But very often it's reported as normal. So based on a person's symptoms, and like if I have someone who's dealing with weight issues and that TSH comes back at the high normal or just above the normal, it's a huge range really in the lab values. And the most therapeutic level of TSH is between 1 and 2. If I were to be replacing your thyroid with prescription, that would be my goal, to get you between 1 and 2. So the range does matter. And I have people bringing their labs in, and we're reviewing them because maybe I'm seeing them today and 3 months ago they had labs done at another clinic. They're like, well, here's my most recent labs. These aren't the best values, sort of like even a vitamin D level. Well, it's in range. Well, what range is 30 to 100. We're not talking about a deficiency if you're at 40 and you're not symptomatic. I'm talking about people who are not feeling well. They're low energy. Maybe their bone density is changing. Maybe they've just had a cancer. Vitamin D is our immune system booster. It supports our bones. I'm not going to stand for a vitamin D of 40. I want them therapeutic. So it does matter, and it matters what else is going on in their body.
Yeah,
Wow, that makes
because
sense.
the so-called normal range, as far as I understand, is like 95% of population range. And that's why I always like to tell my patient, or when I do the education, that you don't want it to be normal.
Yeah.
You want to be the optimal. So
Right.
what is your optimal number, the optimal range?
Yes.
That's what you need to aim for. It's not just to be normal.
Yeah. And I don't feel good at this normal. You know what I mean? That's what they're saying is, something, how does this all come together? And optimal is different. Sort of like the RDA, when it comes to recommended daily allowance. We're talking about a history of numbers that keep us from disease. But now, I have had several women who have been through breast cancer treatment, and they're coming in and telling me, oh, my oncologist is routinely checking my vitamin D. They're routinely checking my biomarkers for my immune health, because I'm trying to battle this. I want to kill those cancer cells. Well, we all do. We're all going to have rogue cells in our body. So why wouldn't I want to have an optimal immune system for when that happens in me, so that my body takes care of that instead of waiting until, oh, gee, you're not ready for this assault, this illness that's come in, whether it's bacteria, virus, or cancer. So yeah, we want to be well.
Very, very true. So from what I understand then is, you want to help people optimize their health so they can arm their immune system to prevent that attack, right? So what's your guidance, and what is your approach in terms of the helping people? Is a vitamin, is a supplement the only answer? Or I have seen a lot of people when they they come in and they talk about, I have a several supplement, and yeah, what do you take on that?
Well, I want them to understand why. And you might not be surprised, but often I will say, so why are you taking this? Why are you take? Well, I don't know. It sounded, my friend takes it, or I was watching something and they said it's good for you. So why are you taking it? Do you know that you need it? Is it a pure supplement? And what else could you be doing in effort to even gain more benefit? So, I mean, I can supplement vitamin C, but how much fruit are you eating? What food are you eating that has vitamin C in it? Are you able to absorb the vitamin C? I've had people with colitis, bowel issues, chronic diarrhea, constipation. They're not absorbing these things. So sometimes we have to boost in order for the healing to happen. But no, it's really important that we see what are you doing day to day. Some people will share with me what they're taking in for nutrition. Food is medicine. Absolutely. This food was placed on earth for us to consume. Certainly there's different pockets, like, they talk about the Eskimos up in Alaska, and they don't have a whole lot of diversity, but it's interesting that genetically they've been able to, absorb different nutrients in different ways. But for the most of us, we need a diversified diet, high nutrition, and food that really, if you don't want to be eating all day long and just taking in empty calories, you want the most bang for your buck. So we're using, the guidelines of the experts when it comes to whole food, nutrient dense, seasonal, regional, and we don't necessarily want to be eating strawberries only from California in January, because that isn't maybe the best time to eat strawberries. So I want to hear from people, what are their routines? What's the diversity in their diet? Because if they're eating high processed, high sugar, routinely low fiber, they're not going to feel good. So I will integrate, what can we add? Yeah, I think one time we were talking about, people who might, they choose Cheerios because they're oats and there's some fiber in it. Well, okay, what else can we add to the Cheerios then? How do we build off of what somebody's already doing? I'm not going to say, oh, you need to change everything, empty your pantry, but how do I add? How do we enhance? And when they understand that their bowel will work better, that they'll make more serotonin, that they'll bathe their brain, the mental health issues that come from a poor diet. And we're giving medication for these, and we're not using food as medicine. So food is the cornerstone. If there's noted issues where certain levels or hormones are off, we can prescribe in order for people to feel better and then make even better decisions. So yeah, lab is really important too. I want people to know, do you really need these supplements? Because my favorite story is about these spas that people are going to now and getting injections and infusions and cocktails, and they'll come in and I'll say, well, what about how do we know what your B12 is or your vitamin D? Or, well, I get an infusion every month at whatever spa, And I did have a gal not that long ago. Her B12 was double what it should be, going on triple what it should be. So she's wasting her money. Thankfully, it's not. I mean, that's why they can do these things in these spas too. It's not harmful, but why go past therapeutic levels? It's costly. I think people need to know before they just blindly take things.
Yeah.
Right. That's why I always like to say that test, don't guess. See your levels before you know whether you need it. And then I also have some issues with supplements. It's not that I don't like supplements. It's how you use it. I always tell my patients, go to left side first and then treat them as medication.
Yep.
And a lot of time I see people, they say they are so proud of themselves of not taking any medication, but they are taking 5, 10, even more supplements every day.
Yeah.
And I'm thinking, you are not healthy. No, it's not that you have good lab results that you're good.
Right.
And number
Right,
two,
right.
I have is a lot of people, especially from they are promoting supplements, say you take this, no, you'll be well. And I'm thinking, what if someone who cannot afford to buy all the supplements, are we making health
Yeah.
as a privilege?
Mhm.
It's not our basic rights anymore.
Right.
Good
So
point.
that is what I have with the supplements. It's really, we have to go down to the basic, treat the root cause, and don't just take it blindly. Yes.
Absolutely.
Yeah.
And to learn how to, prepare food so that it is yummy, we were talking about the season of roasting vegetables now, and it's so wonderful. It's cold outside, so the kitchen is warm. The oven is full of roasting vegetables versus, overboiling something and having it mushy or, in a hot dish or something like that. So how do we train people to eat the food so that it even tastes better? It's really important. And I know Lotus is doing that, teaching people, this is a great recipe, try this. And it's so fun to see people's face light up and say, wow, this is good,
Wonderful. Good comment. I love it. So from my understanding, Dawn, your approach is you invite the new client to give them to provide their information, medical history, so you can review before the visit, and then you try to understand what they are doing, what they eat, and their lifestyle. And from there, you will make a recommendation on the blood work needed, like you mentioned, the blood work, the panel for thyroid. And then once you go over the lab with them, it's not black and white. Okay, it's all red or blue, because you explain their situation right now and make the further recommendation. So normally, how often you follow up with them just to make sure they are on right track?
Yep.
Yeah.
Yeah, I think different people just, truly, sometimes I love that. Oh, when people say, okay, what's the first step? How do we stepwise approach? But most of the time, when people are willing to come in and talk about what they need to do, they're like in active phase. So it's like, okay, I'm already doing this, this, and this. I want to know more about that. And what are some options? It's very consultative. And, sometimes people say, you're crazy. I that's overwhelming. So then where do we start? And it takes time. I've had people where the timing is all right. It's great. They're implementing. I've had other people that realize they've got a lot of things to change, and the timing is poor for making. They're under very stress, whether it be work or someone they love is very sick, or they can't even imagine getting a new job, because stress and cortisol will affect everything. And then it's overwhelming to say, well, have you considered a new work? And I had a gal the other day, she's like, well, I'm like considering moving to South Carolina because that's where my husband's family is. That's where, these are big, big barriers to health when people are isolated or not living where they want to be or can be. So we have to take it all into consideration, and that follow-up fits into that. And many times too, I'll have people say, well, that makes sense. Okay, it's going to take me a while to do this,
That makes sense. Yeah.
Yeah. So that you mentioned the cortisol. Cortisol usually is the first thing people think about, but there's something more subtle that people don't realize. Just like we're talking about thyroid, from T4 to T3, the active form. But when there's inflammation, the people have too much inflammation inside the body, then it converts to reverse T3. It's converting, but it's not functional form. And so how the inflammation and all this cortisol can work together to damage your system. For example, your fatigue, your mental health, or even go into your gut, your microbiome, how they all connect together.
Yep. Well, and as you were saying that, I was thinking also, I just read a very good article about how this excess estrogen for many women is inflammatory, and it does that. So, we say, why do so many women have issues with their thyroid? And after pregnancy, well, we gain weight. We are hyper estrogen during pregnancy. And then afterwards, maybe we haven't lost that weight, or then we start losing that weight and we're flooded with estrogen. It's pro-inflammatory at excess levels. And then it offsets so many levels of function. So yeah, cortisol, too much estrogen, not enough progesterone. We just have to find out where it's coming from.
Okay.
So there's one question I saw online. Is aging a medical condition?
Yeah. Love this. Love this.
Well, we all want to know how old people are because it's something that's a factor, and I'm trying to remember what physician it was. It said he believes that two things confound everything, and one you can't change, it's your age, and the other is stress. So the stress response, the inflammation, the cascades. I have people who talk about their high histamine levels. Well, that's happening in response to what's going on in the body. But age, it's a fact of our condition, yeah.
But I also heard that when I talk to so many people, they call in and they just feel helpless because they have been bounced back and forth among different providers.
Yep.
They know their body, they know that something's wrong. But again, when their provider see the lab and say, "Oh, you are normal," but depends on what kind of a test they have. But they all even at age close to 40, not quite 40, and say, "Oh, it's about aging." Say, "What? I'm only 40."
Oh, yeah.
So I think I mean, right now, as you mentioned that our body is so inflamed, and then what people put in their body really matter. So when it is jumping, it's called junk in and junk out, right? So how do you blame on aging for every kind of a symptom that you have? So have you experienced your patient that they kind of feel like helpless
yes.
on that way? Yeah.
Oh, yes. And actually, so women, especially going through changes in their menstrual cycles in their 40s, which can happen, most by 45. And those transitions, absolutely. But we can't just blame it on that. It's much more complicated than that. We have to help women understand what's going on. The other thing that I see is the elderly people, and I feel really bad when I hear their stories that they're literally told, well, Sue, you're 75 now, so this is all to be expected. And that's really dismissive. That is so dismissive. And it might be a person who's been very active and felt well most of their life, and they're just saying, well, you're 75. So I would never have that kind of conversation with someone, especially unless, there was something else that dramatically changed. I can't imagine telling somebody that, but we do tell people that. We don't, you know, but people are told that routinely in medicine. Yeah.
So
My oldest patient ever was 114 years old. I saw her from 112 to 114. So whenever I have patient coming in and say, I'm old, I'm just like, give me a break. Don't even mention it. She was walking with a walker at 114. And mine was so sharp, I kept reminding myself, don't ask medical history.
Yeah.
So, but I do want to put out one question for you is we always talk about hormone, but what is the relationship between this hormone and immunity? I remember as a medical student preparing for step 1 exam, and the teacher said, if you see the question talking about a childbearing age women, choose autoimmune. No matter what, choose autoimmune.
Yeah. Well, I think, well, like you said, though, there's a dysregulation and then there's inflammation, and it causes tissue changes, fluid imbalances, digestive issues, opportunistic infections when we're under that kind of stress. So, like I was saying too, until my later 15 years in practice, I think maybe I'm just coming to a better understanding too, but this endocrine system that we have in us is magic, but it's very sensitive. So if we're under illness or stress, it's all going to be off. I remember when somebody said, well, yeah, if you ever check a reverse T3 on a patient in the ICU, it's going to be elevated because the patient is under stress. So there's a lot of hormones that we should not be dismissing so lightly.
So what is the very simple step that you guide your patient when they deal with the common issue like you have mentioned, weight gain, they feel fatigue, they don't have energy, they just don't feel right. So what is the basic that you will guide them to get started so hope they can feel better?
The first thing is what's going in their mouth.
Okay.
And what is going out in the bathroom. I will have women say, oh, I might have a bowel movement every 3 days. Well, you're not going to feel good if that's the case. So it's what's going in and what's going out. And then I think about the environment. There's just a discussion about, our stress response. Am I juggling 2 jobs and 3 little kids at home and a husband who needs help with his farm work? It's near impossible for us to do some of the things that we're doing. So I like to put light on the subject and help women, especially women, to understand they really are not superpowers, and that there has to be a hierarchy of what we can do. But how do we support our bodies? It used to be not that long ago, it was exercise, get out there, get more exercise. And now it's rest. If you're not getting rest, we're going to be in trouble. So it's those pillars. It's the pillars of rest, digest, nutrition, release of toxins, and releasing the whole environment, or involving in the quiet time. We talk about meditation or prayer, whatever you want to call it. It's the package. And so we talk about each of those from the very beginning. And then where do you want to work on? What's your priority? But yeah, I try to get people using the bathroom more and eating more diversity. Get them their labs and say, okay, this is the package.
Yeah.
Well,
because I think that they will say, well, according to the advice, it is the normal bowel movement frequency is from 3 a day to once every 3 days. Now, again, we'll talk about normal range, right? It's not optimal. And another thing, a common thing I like to hear, I hear is, they say, oh, my doctor said eat more fibers. And I'm thinking, how about water? When you increase your fiber, which suck up all the moisture, water inside your gut, and you don't eat water, that is going to be even worse.
Yes.
So water is really the thing that we don't usually think about.
To hydrate ourselves, very important. I also capture what you say, Dawn. You mentioned about the nutrient dense
Mhm.
plant. So it's not just a whole food plant-based, because a plant, it can be like what um the Oreo is a plant. It's a plant-based, right?
Shredded lettuce,
Yeah.
shredded
Yeah.
iceberg lettuce.
Yeah.
Yeah.
So
No.
can you share like a couple food that you consider it's a nutrient dense that you normally will say, okay, focus on those group. What does it mean by nutrient dense, by the way?
Well, whole grains,
Mm-hmm.
if we're utilizing the whole grain, um, and so oats, barley, kefir, quinoa, something that is very similar to the way it looks like when it comes off the plant. The
Mm-hmm.
cruciferous vegetables, those
Mm-hmm.
guys are power packed. I mean, you can
Mm-hmm.
ferment them, you can do just about anything with them. And I like to talk about resistant starches.
Oh.
So, that's why it's really nice if people are into that sheet pan roasting. So
Mm.
you've got these beautiful, maybe sweet potatoes and Brussels sprouts and cauliflower, onions, even garlic cloves. All of those things on the pan, and then you throw them in the refrigerator, and then they cure, so to speak, so then you get a more resistant starch. And what is a resistant starch do? It keeps your blood sugar more stable. So we're not doing this. And
Mm.
that's the other
Mm-hmm.
thing. I'm surprised I didn't talk about that, when people have highs and lows with blood sugars, they don't feel
Mm-hmm.
good.
Mm-hmm.
Headaches, fatigue. Oh yeah, after I eat, I could take a nap. Well, we're going to talk about what they're eating
Mm-hmm.
and how they can most likely need to get their insulin resistance down.
Mm-hmm. Mm-hmm.
Um, yeah, I like to talk about food that can be prepared and kept in the refrigerator, reheated, or truly carries its nutritional
Mm-hmm.
pattern.
Wonderful.
Yeah.
Yeah.
I especially like the berries, those strawberries, blueberries, some seeds. That to me is very good. And
Yep.
are we able to put chocolate on the list?
Chocolate? Yes.
Chocolate.
Yes, cocoa. Well, cocoa nibs too. I haven't used them in a while, but they can transition people off of chocolate chips using
Yeah.
cocoa nibs, and they're nice and fibrous and all that good stuff. But I
Mm-hmm.
think when we get used to not eating as much sweet,
Mm.
Mm-hmm.
there's so much more food that is really very yummy.
Mm-hmm.
I mean, I had some squash come out of my garden too, and it's just beautiful and so yummy and creamy, and there's a lot of nutrition in it. So, um, yeah, I think we're blessed in this area of southern Minnesota that we have a lot of really good food
Mm-hmm.
available to
Yeah.
us.
And seasonal. So, well, on that topic, well, now we are getting into winter in Minnesota. Well, something kind of uh, people have a different feeling about toward the winter. But I heard that you have some fun work to do during the winter. Can you share with us what's your typical day in winter?
Well, yeah, I was teasing that if I didn't have my little barn that's about, I don't know how far from my house. We're on about 7 acres, and I would just drive into my garage and go in and stay all snuggly warm. But instead, I've got a donkey and little pygmy goats and two sheep and ducks and chickens and a cat, and so I have to go care for them.
Oh.
And so especially during this weather, I know I wouldn't be outside like I need to be outside.
Mm-hmm.
Maybe it's a little briefer and I'm bundled up, but if you're going out, stomping across the yard, breathing in some nice crisp air, and then nurturing something that you love. And
Mm-hmm.
these friends of mine are really good for me. They're
Mm-hmm.
very good
Mm-hmm.
for me. I pretend that they love me, but they know I feed them. So whoever would go out and feed them all the time. But yeah, we need hobbies. I've got snowshoes, I've got cross-country skis, and that's how I would rather. I take my little dog for a good brisk walk. So pets are very life supportive too.
Are grandkids considered pets?
Oh, well, mine is like amazing. Yeah, he's lots of fun. So, no.
Yeah. Wow, so wonderful. Yes, I can hear, I can see it. Of course, they love you.
Yeah,
You
of
know,
course they love me.
yeah, I think they can sense that the love is mutual. That kind of that kind of mutual relationship with the pets, with your family, with your
Yeah.
lovely grandson. You have a
Yeah.
grandson.
Yeah.
Yeah.
Yeah. It's a
So
reason to get outside.
reason to get outside, and then I kind of develop this we still call a sense of a purpose. Why, right? We wake up, the first thing is we visit, we have this purpose. I can see your passion when you talk to your patient, or you just want to help them,
Yeah.
guide them, give them a hope. So,
Oh, yes, yes.
yeah.
Nothing worse than thinking you might have to suffer and live in a way that can't change. We're made to heal. We are made to heal.
So
And that's a compassion you develop. Yes,
then
Dr. Lai.
in Minnesota, this cold winter, one of the big issues during winter is mental health, emotional health. How would you suggest people boosting up their mood if not everyone has a barn,
We don't have a donkey.
Well, and I ask people, do you have sidewalks in your neighborhood? Do you have a park? Where do you live? Are you isolated? Who are your people? Are your grandchildren close? Do you have a parent that needs you? I know I went through a year of time when my father was really needing more help. And talk about purpose. It was like, Dad needs me, and other things had to be quieter, that this is the hierarchy, and like when my grandchild was born, okay, they need me here. So that changes, at different times in our life. But hobbies, what happens when we get overwhelmed with our work or things that are heavy on us? We start giving up our hobbies. We lose our creativity. My sewing machine for years sat unused. And it was kind of sweet because I was on a Zoom call or call with my second child, and she said, "Mom, you're at the sewing machine." I'm like, "Yes, this is good. This is good." So having the energy to be creative, to do the things that we enjoy doing, that might be going out and or meeting your friends for cards, but we have to be called to get up and do something.
Yeah.
And without that, it's very lonely, very sad.
Yeah.
And we talk about loneliness when we're connected on our phones, but winter in Minnesota, there's a lot of great things going on. And it is beautiful, but we have to feel well enough to get out there and do it. So if you're not feeling good, let's figure out why and get you back doing the things that you enjoy doing.
Yeah. Yeah. Very good point. Well said. Well said. Well, Dawn, I love you. I just, we are so lucky to have you at Rochester Clinic, as you, so caring, for people, and you listen. You have the compassion, you feel for them, you want them to be well, but at the same time, we also need to take care of ourselves, right? We have our family, and then take care of our hobby, right? We have something we like to do, and our creativity. That is so important. Yeah. So,
Yeah, I feel very blessed to be here. I mean, Rochester is destination medical center for a lot of reasons, but and as I've said, I learned many, many wonderful things from Mayo. But I know there's more, and we can partner with Mayo.
yeah.
And that's what we do here. We're not isolating any other care plan. But there's more.
Yeah.
There's more.
Yeah, definitely. So, as we say that we always look forward to our annual conference. The next one is April 9 and 10. And we have so many Mayo Clinic physician friends, colleagues that looking forward to this big event. We enjoy the learning, wealth of information from the experts across the country. So,
Yes.
yeah, we have a lot more to share in the future episode. So, yeah.
So, toward the end, what would be your best advice for people to do a good self-care?
I would say routinely, you've got to take a little bit of inventory about where you are in your life and what are the new priorities for either the season of your life or the season of, the year, and then reach for that goal. I think we forget to do that inventory because life changes. What is our purpose? What are we called to do? How come we're here? We all have these beautiful gifts. So I really do encourage people, and it's not unusual that when I ask that question, there's tears. Well, I used to do this, or I used to do that, or I wish I could do this. So then how do we get there?
Right.
So you have to have a why, and then, go for it.
Yeah. Wonderful. So our advice to our audience is, don't wait. Come to sign up, have a visit with Dawn, have a conversation. Even just like have a conversation with you at the visit is very therapeutic. On top of getting a lot of information and to know where we at, and so how we can better optimize our health. And that is so worth it. The investment on a visit with a great providers who is very knowledgeable. So definitely very worth.
Yeah.
Yeah.
I think we do, when we have conversations, when people call and say, well, I really love my primary care provider and I really like what we're working on there, but he or she can't really answer some of these questions that I'd really like to ask. Could you help me with some of it? Yes. And if we can't, then we go to the next person who is the expert, because that's really hard, to leave and have questions unanswered, or well, I watched this on YouTube, or I listened to so-and-so, and they're like, who are you talking about? That's not even, don't worry about that. It's like, no, I don't think we would ever tell someone that.
Yeah. Yeah.
Yeah.
Okay.
So how will anyone get on hold of you?
So call the Rochester Clinic. What is our number?
507-218-3095. RochesterClinic.com or health@rochesterclinic.com email.
Yeah. Well, thank you so much, Dawn, for your time.
Thanks for the invitation.
Yeah. Well, we look forward to a fun winter, and so yeah. Well, Dr. Lai, Dr. J. I'm so sorry. I should make sure that change. Dr. J, should we close today's conversation?
Thanks for joining us on Healing Step to Wellness. I'm Dr. J.
I'm Mei.
Guiding you toward whole person health, one step
and one bite at a time. We will see you next time. Thank you. Yep. Bye-bye.
Bye.